Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Carrie Ann Williams. I'm a psychiatrist practicing here in Massachusetts, and this is a show that's about everything related to mental wellness in the Black community and beyond. In today's show, I wanted to cover a term that we've all been hearing about in the news recently. It's a term called high-functioning depression. High-functioning depression is a lay term. It's not an official clinical diagnosis, but it's a term that people often use to describe someone who is suffering from depression, but is able to give the outward appearance of functioning well. So people would perceive them to be generally happy and successful in life, but they are somewhat secretly depressed. So I was trying to think this through in terms of where it might fit in terms of an official psychiatric diagnosis. And I feel like it kind of goes in two different directions, but related. And so what I wanted to do today is just spend maybe about 20 minutes just talking about high functioning depression and where that might map on to our official psychiatric diagnoses. So one particular direction to go in would be the person who meets most of the criteria for depression, but doesn't meet all of the criteria. And in particular, there's kind of this golden criteria for diagnosing mental health conditions, which is that it should affect social and occupational functioning. Now, because this person may still appear to be functioning well, career-wise, and they may be functioning well in terms of their social life, they appear to be having no problem with their social and occupational functioning. So they're not meeting the full criteria for depression. In this case, they end up with a diagnosis called unspecified depression. Unspecified depression. So they're meeting many of the elements, but just not enough to meet the criteria for what we might call a major depressive episode, or clinical depression is what some people might talk about. And so I'm going to talk about that path in a little bit. The other way to kind of think about high functioning depression, and this one I've seen more that experts have been using, it is persistent depressive disorder. And this used to be called dysthymia, but is now called persistent depression. And this is basically like a low-level depression that's just kind of present all the time. And so you may be functioning, you're maybe going to work, going to social events, but there's just this internal background depression that's just compromising your feeling of reward in life. It's compromising your feeling of meaning in life. And I'm also going to talk about this path as well. Again, they're related, but they have some slight differences. First, I wanted to just review a few of the symptoms of depression so that we're, when you hear me use the word depression, we're kind of talking about the same thing. The most obvious thing that can happen with depression is a change in mood, things like sadness. But apart from sadness, there might be some other things that you may experience because not everybody identifies with the word sad. So what might be less obvious is that you may be experiencing more irritability or more anger. You may be grumpy. You may be snapping at people. You may find that you're just less patient than usual. So you have less tolerance for people. You have less tolerance for your kids, less tolerance for your partner. And some people would say that they just kind of feel blah. They feel empty. They feel emotionless, neither happy nor sad, maybe even kind of numb. And all of that falls under changes in mood. And so that could be part of the low-level depression. You just kind of feel that way all the time, low tolerance for people, feeling emotionless. Or it may be part of the unspecified depression, which I'm going to talk about later, is more episodic. Then part of depression is a decreased feeling of reward. The technical term for it is anhedonia. But it's a decreased feeling of reward. And basically, that like great feeling that you get when you do something that you enjoy, like you go on a bike ride or you bake a cake and you feel this nice, great, warm feeling inside. Well, Depression has a tendency to diminish that feeling. You can do all these same things that you normally would enjoy, but you may not feel the same level of reward with doing it. So I often will ask patients if they feel like they're just going through the motions, or if they feel like they're just doing things out of obligation rather than out of enjoyment. And that helps to give me a sense of whether they're getting the same feeling of reward in life, or, that feeling of motivation to do things. You may even have a change in eating patterns, and this can go one way or the other. You can find that you are just not feeling as hungry as you usually feel. You're just not eating as much, and you may even lose weight. Or you may be engaging in kind of some mindless eating even when you don't even feel hungry, just eating more than usual, and most commonly kind of craving comfort foods, and things that might be sweet or salty, or carb rich, and that could cause some weight gain potentially. You may have changes in sleep. This can also go either way. You may find yourself sleeping a lot, kind of more than usual, maybe taking daytime naps, kind of sleeping for longer periods at night. Or you can have disruption in sleep. And in this case, you may have trouble falling asleep. You may be waking up during the night. You may wake up kind of earlier in the morning than you want to and not be able to fall back asleep. So you're kind of wake up at like 4 and you're just up. You can't go back to sleep. You're up for the day. That could be a sign that your body is going through a depressive episode, or experiencing a depression. Now, depression is often accompanied by negative thoughts, pessimistic thoughts. So you start to expect bad things to happen. You start to expect failure. You start to expect adversity. And you call it realism, but it really is pessimism. You become a glass half empty person. And in the worst case scenario with depression, you can start to believe that you're a burden to other people, the people around you. And that can lay the groundwork for hopelessness. Now, hopelessness is one of the more concerning aspects of depression. It's an indicator of severity, because hopelessness says there's no point. What's the point? And that can be accompanied by helplessness, which says there's nothing I can do, or there's nothing that can be done. So let's put this all together with depression, right? If you start feeling empty and you feel like there's no feeling of reward or enjoyment in life, and you start feeling like you're a burden to other people and that there's nothing that you can do about it, then you may start to have thoughts of not wanting to be around anymore. And that's a situation where you need professional help. I'm a podcaster. Even though I'm a psychiatrist, as a podcaster, I can't help you with that. But you need to speak to your primary care physician or GP, or if this is a kind of an urgent issue, call 911, or otherwise Google the suicide hotline for your area, depending on where you're listening from, what country you're listening from, but seek professional help. So now that we've kind of talked about some of the basic signs and symptoms of depression, let's talk about those two kind of pathways that I mentioned earlier, unspecified depression and persistent depression, and what kind of high functioning depression might you have. So here are some of the differences. An unspecified depression, and this is kind of how I think about it, and I think this is also how we kind of diagnose it. It's more of a branch off of major depressive disorder. And as I said before, major depressive disorder is probably what you might refer to as a clinical depression, a full-blown depressive episode, okay? But major depression is episodic. That means that you're going to have some times that you feel depressed, and you're going to have some other times where you feel like the depression has lifted. Okay, it comes and goes. You get a break sometimes, okay? Now, some people who have high-functioning depression will experience their symptoms of depression episodically, just like that. It comes and goes. And again, they may not be meeting all the criteria for depression, but the criteria that they do meet, they're meeting it episodically, and then they get a break. They get a break and they feel better. It comes and goes. When it happens, it does affect them personally, right? Personally, they may be experiencing the changes in mood and appetite and sleep and energy and all of these things. And their close family may also notice it and be affected by it. But acquaintances, maybe coworkers, may not notice that that's what's going on. And so this is one type of high functioning depression that I think some people might identify with. It comes and goes, it does affect them, but they're somewhat able to kind of function despite it. Now, if you have high functioning depression in the form of unspecified depression, you should know that you are still at a higher risk for developing thoughts of suicide. You're at a higher risk for developing a full-blown major depressive episode because you're one step closer than someone who's not experiencing depression at all. So it's still important to pay attention to that. Even if you have episodic unspecified depression, it's still important for you to meet with a professional and potentially be treated with medication or have therapy, this sort of thing. So don't ignore it because you are at a higher risk also for anxiety and other things. So now I'm going to talk about high functioning depression in terms of the persistent depressive disorder or dysthymia. And this is a low level depression that's present all the time. It's not episodic. Okay. You don't really get a break. And so this one may resonate with quite a few people. They just kind of feel this way all the time. Now, officially, you would need to have this low-level depression for at least 2 years to meet the criteria for persistent depressive disorder or persistent depression. And again, you'll have a lot of the same symptoms I mentioned before. It's just kind of there all the time. You have the mood changes. You feel low. You feel underwhelmed. You may be feeling blah or feeling empty. And you may not feel a great sense of reward for things that you do. You may be achieving a lot, but you don't feel the sense of reward with the achievements. And even if you do feel that reward, if you feel happy, it's like short-lived. You go to the party, you enjoy the party, but then when the party's done and the noise dies down and the excitement is gone, you kind of go back to this steady state of low-level depression. You may even start to negate the things that you earned and say, oh, wait, well, it was not a big deal anyways. Because remember, depression is negative and pessimistic. So you may start to kind of filter out the positives and magnify the negatives. Okay. So people who have a persistent depression may overall have a generally pessimistic worldview. And you may think that it's your personality, but it's actually the depression. And it's interesting because it's kind of like low-level depression just hangs around so much that it becomes a part of your life and something that you actually become so familiar with on a psychological level that it can sometimes even be a little bit of a hindrance in therapy and recovery. And I'm going to talk about that a little bit towards the end. So how does a person with persistent depression look to other people? Because I know people want to know, how can I recognize it? Well, interestingly, some people can give others a perception that they're happy, particularly if they have a naturally extroverted personality. They can come across as quite social and energetic around other people. They can be incredibly talented and very productive and even sought after. And by all accounts, they may seem very vibrant and successful. But again, when the noise dies down, that depression is still there on the inside for them. It's just always underneath. Okay. That is kind of the more difficult presentation for you to be able to recognize that the person is depressed. Such a person may have to bring themselves to get professional help because it may be difficult for people around them to know it unless the person is very close to them. Now, other people who have persistent depression, they actually do look persistently sad. Kind of like that character Eeyore from Winnie the Pooh. It's just difficult to get them to be excited about anything. You could get them their favorite food, you could buy them an expensive vacation, and you may just get a very moderate reaction. And it's not, they may still express gratitude and things, but the reactions, the excitement, the enthusiasm, the vibrancy is not there. And again, people with persistent depression are at risk for having a major depressive episode In fact, that's sometimes how they come to treatment, because you can have a persistent low-level depression and just kind of be living with it and trying to survive. But when it kind of evolves into a full-blown clinical depression, a major depressive episode, that's often when people start to talk to their PCP about it or seek a therapist. So you can go from having a low level depression to having a full blown episode. And that can happen periodically, can happen episodically. And we used to use the term double depression when somebody starts off with kind of just this baseline low level depression, and then periodically it becomes a full blown depressive episode. It's like a double depression. So it's a very kind of high risk situation. And of course, along with that, the part of the risk is the risk of having thoughts of suicide. So one of the things that are kind of notable here is that people who don't have persistent depression, if they just have the unspecified depression that's episodic, they go from having the episodes to having a break. They sometimes feel okay. They sometimes feel like themselves. But people who have a persistent depression, after they have a full-blown episode, when that episode resolves, they go back to a baseline of still feeling depressed. And so they never get a break. And so if you kind of combine that with this kind of feeling that things are just bad and that the pessimism of that things will never get better, you have definitely a recipe for just being incredibly disabled in many ways, emotionally and psychologically. Now let's talk quickly about the treatment. The treatment for high functioning depression, it's not anything revolutionary. It is a combination of therapy and medications. In fact, I was reviewing a review from 2020, and basically their conclusion was that the most important piece of treating a persistent depression is the medication. And I know sometimes in the Black community, we have this mixed relationship with whether or not we accept medications, but the research has shown that for persistent depression, the most important piece is actually the biological treatment, the medication treatment. However, the combined treatment with medication and therapy is the superior way to go. So top of the line would be therapy plus meds. Second to that would be medication. And they found that if you try to just do therapy without medication, people only had very marginal success. So that's going to be the key here. So the temptation, right, with a high functioning depression is that you can somehow just push through it because you're still going to work and you're still socializing. It gives you the impression that you can really just kind of like work your way through it. You can convince yourself you just don't have any time to slow down. You don't have any time to meet with anybody. Or if you do finally go to meet with somebody, you come to find out the treatment for persistent depression is not short-term. It may be a long-term treatment. You may have to be in therapy for a while. You may have to be trying more than one medication to find the medication that works for you. It's not a quick fix. And for people that are busy and productive and have this low-level depression, you have to kind of make time for the fact that the treatment it may not be a quick thing. The other thing I just wanted to mention is, when you do look for a therapist, find a therapist that you feel like you can connect with, one that you feel like you're making some progress with, and pay attention to if you feel like your therapy hits a plateau. Okay, a plateau, of course, is where you're making progress up to a point, and then suddenly you feel like you're stagnant, that the progress has stopped. And that can happen for a variety of reasons. But in some situations, you may have a therapist who they've reached a place in therapy where they're not sure where to go next. They're not sure how to help you, but they have trouble admitting that. And so you're kind of just in this plateau phase where you're going to therapy and the therapist has now kind of gotten to a place where they're not sure where to help you because your depression is so persistent. And in that case, I hope you can feel empowered to, seek a new therapist. Maybe you need to kind of get a fresh face and see if there's someone else that may be able to kind of pick up where that person left off. But the other situation that I've seen happen sometimes too, and this is kind of, I alluded to a little bit earlier, it's a kind of more advanced situation. This is where the depression has been with you, that low-level depression has been with you for so long that it becomes a part of who you are. And you don't know where the depression ends and your personality begins. You begin to interpret symptoms of the depression as being a part of your personality. And what can happen is that at a very unconscious level, you're unaware that that could be actually hindering the progress in therapeutic work. And as I mentioned before, that's kind of a more advanced kind of formulation of sometimes what happens in therapy. And it's part of the reason why you need a very competent therapist to work with you when you're struggling with a persistent depression. Now, the other thing that I haven't mentioned yet is that sometimes it matters where and kind of like how the depression came to be. Because, for some people, there's really nothing they can pinpoint. It's just truly just biological. It came out of nowhere. They're not sure why they have this low level depression. But for some people, they can pinpoint some adversity that they've gone through in their life. Maybe they've had some kind of abuse in childhood, or maybe even in adulthood, they've had psychological and emotional abuse in a relationship. And then ever since that time, they've suffered with a low-level depression. And when that's the case, sometimes they carry this around with them kind of throughout their life. And it kind of just erodes their quality of life long term. And in this case, they may be experiencing a post-traumatic stress disorder or PTSD. And so when your depression is connected to trauma, you definitely need to work with a competent therapist, and you need to let your psychiatrist kind of know what's happened in your life, because that could also affect some of the prescribing choices that they make. So that can sometimes make your treatment course a little bit different. And so it's important to be able to identify when your depression is connected to a trauma. I think in the Black community, it's been well established that in many ways we have higher rates of depression, but lower rates of seeking therapy. And especially for Black women, if you're experiencing a high functioning depression, there's kind of like a pressure both internally and externally to push through your symptoms. It's easy to just minimize it in your mind and say, I don't have time for this, and just to kind of barrel through. There's a lot of demands on your time. There's a lot of demands on your abilities. And for Black women and Black men as well, there's this added pressure to overcome stereotypes that have been placed on Black people. So you want to kind of, show that you are productive and you're an achiever. And, you're acutely aware that as a Black person, you're kind of representing all Black people, particularly if you live in a country like the US where you have been minoritized. The stakes of slowing down just feel too high. Given that Black women are already at high risk for depression for just complex psychosocial reasons and historical reasons, they're also at high risk for high functioning depression. So I know it may feel like if you stop, slow down, that it feels like all these plates that you're spinning, that they might just all come crashing down if you try to disrupt things. But it's really, really important for you to kind of stop, slow down, and seek combination therapy of both medications and a therapist. And often there is a wait list for psychiatry. So I just want to acknowledge that it's difficult to find a psychiatrist quickly. I mean, sometimes people have asked me, can you find me a psychiatrist as soon as possible? There's often a wait for that. So maybe, you might want to start with your primary care physician or your GP, because they can also prescribe antidepressants. And maybe you start there with medications first, and go ahead and try to get on a waiting list for therapy and for a psychiatrist, so you'd be able to see a specialist at some point in the future. So maybe that's the way to go. So guys, that was my 20-minute kind of breakdown on high functioning depression. Do you feel like you have high functioning depression, or do you know someone who has high functioning depression? Reach out to them when you sense that they may be isolating. That's one thing I forgot to mention, is that sometimes people who have depression will isolate themselves socially, and it does not help. Even though it may feel like it's a recharge or a self-care or whatever people use to describe it, isolation is not helpful in depression. So you may want to reach out to your friend who you may be noticing is isolating. Don't overwhelm them by inviting them to some large social gathering. Just stay in contact with them, maybe meet for them one-on-one for lunch to get them out of the house. Be careful about saying or implying that people aren't doing enough. Because remember that depression is highly biological, and that people with depression often lack energy or they struggle with fatigue, and they are actually trying their best. So, thank you guys for listening. Let me know, what did I miss? What do you guys know about high functioning depression, persistent depression, unspecified depression? Drop a comment. Let me know. Share your wisdom with other people. And I will talk to you again next week. So have a great week.